dengue in Brazil killed more than COVID-19 and TB last year. It's the first leader of infectious disease killer in Brazil. But in general, the people believe that's a middle disease.
The original thing is that we decide to give adolescent, which is an age group which is difficult to get the vaccine for any vaccine.
Welcome back to the WSPID podcast series brought to you by the World Society for Pediatric Infectious Diseases. I'm Alicia Chang, a pediatric infectious diseases specialist working in Guatemala City.
And I'm Daniel Jarowski, a pediatric infectious disease specialist working in the Department of Pediatrics at Santa Casa de Sao Paulo, Brazil. We are your hosts for this episode. Today we're diving deep into dengue, from classic to complicated cases to the lessons learned from vaccine implementation in Brazil and Argentina. Before we introduce our guests, we'd like to remind you to check out the Global e-learning portal on the WSPID website for access to resources on the topic. We are privileged to be joined by two esteemed guests to help us with the discussion, Julio Croda and Eduardo López. Dr. Julio Croda is Associate Professor at the Federal University of Mato Grosso do Sul in Brazil and Yale School of Public Health. He's a researcher at the Oswaldo Cruz Foundation, and his work focuses on epidemiology, clinical trials, and programmatic data analysis. Dr. Croda brings over 5 years of experience in leading vaccine trials, including vaccines targeting COVID-19, dengue, tuberculosis, and chikungunya.
Dr. Eduardo López is a professor of pediatrics and vaccinology at the University of Salvador School of Medicine in Argentina. He also is the director of Pediatric Infectious Diseases program at the University of Buenos Aires School of Medicine. And he is the medical department chairman of the Ricardo Gutierrez Children's Hospital in Buenos Aires. Thank you both for taking the time to join us today. And we're going to start with Eduardo. Dengue is a well-known disease in many regions, but for those who are not as familiar with the disease, could you summarize briefly the clinical presentation of classic dengue in children?
Yes. Well, as you know, we have a huge outbreak in Argentina about dengue. Was unexpected, mainly in the big and urban cities. In our institution, we care 566 children with confirmed dengue using PCR and or NS1 assay. The main findings, the clinical finding at the beginning was 100% of patients had fever, 90% had headache and retroauricular pain, and 86% had myalgia. Rash was present in only 56 patients, and this is the triad to suspect dengue. It's very easy to suspect dengue when you're having a huge outbreak, but it's not the same when you have sporadic cases. Then, for a pediatrician, you have to keep these three findings. Fever, almost 100%, headache, and myalgias. This is what was the presentation of the disease in Argentina. We submit this data in the last ID Week 24 in October in Los Angeles.
Wonderful. Thank you for that, Eduardo. And now for the next question, I'm going to ask both of you to tell us specifically if you have seen a typical or complicated cases of dengue in your region, and what factors do you think that may contribute to the severity of the case presentation? So maybe we can start with Eduardo, since you answered the first question, Eduardo, and then Julio may answer as well. Thank you.
Okay, thank you. The main difference between mild, moderate, or severe dengue is at the beginning is the warning signs. This is something that was very clear in the World Health Organization guidelines as well as the CDC. In our setting, 1/3 of the cases have a warning sign, mainly mucosal bleeding, and 18% was with vomiting. However, as soon the disease continues in the evolution, you have to add other warning sign, such as increase the hematocrit, abdominal pain, uh, and increase of the liver transaminase. Usually, we don't have many cases with co-infection or underlying infection that can uh, have a more difficult outcome. Then I think that the most important for the pediatrician is to detect early the warning signs, intended to refer the patient to a tertiary care centers or another hospital who have more uh, capacity to care this patient. No, the other thing is uh, in laboratory thrombocytopenia was another uh, the descent of thrombocytopenia rapidly is another warning sign that you have to keep about. I think that Julio can add more data about that.
Here in Brazil, we have a huge outbreak in 2024, and especially for children, it's very important to understand that you have a lot of dengue cases with wine sinus and severe dengue. And the problem is the majority of the doctor only keep attention in the lab results, especially the plates, and not recognize the wine signs. And this is become big problem in Brazil. Your lethality increase because the doctor not well training. The majority doctor think about the bleeding sinus in respect of dengue and don't recognize the wine sinus. And this delay the treatment, the hydration of the patients. For the pediatric patients, you have especially very young patients, you have more difficult, especially because the children don't tell the symptoms, the weight symptoms, vom, abdominal pain. Maybe they present with anorexia and more mild sinus. It's very difficult to recognize severe dengue in young children. And in Brazil, you have a lot of deaths, and the majority of deaths it's related to doctor assistants and well training doctors that recognize these signals. You don't need to wait for lab results to decide in respect about the treatment, about the hydration of your patients.
Let me add a little question. Many times, pediatrician or physician think that dengue is a mild disease. It's not a real mild disease because it has high morbidity and you requesting many patients to go to intensive care unit. Then I agree with Julio. You have to detect early and you have to keep in mind the warning sign. If you have not enough experience, it's much better to refer the patient to a care center who has all of the capacity to make the diagnosis, lab, and so on.
So I heard that dengue is an issue for both countries. Julio works in central west part of Brazil. It's a region that has been hit by dengue for decades and very hard, not just last year, right, Julio, but the
Right.
former years as well. And Eduardo, on the other hand, lives in the country which had some cases of dengue in the north part of the country, but has seen the disease spread further south to the capital, Buenos Aires, for instance. So two different perspectives of how dengue impacts the lives of the pediatrician in both endemic and new endemic regions. So, with that in mind, I will start with Julio. Have you seen any particular typical or even complicated cases that you could share with us, just very briefly? And what key messages can you bring from these cases so people who are not so used to dealing with dengue can learn and prevent deaths or complications?
Yes, maybe I saw one case that have a fatality outcome. It's a young uh, children, girl, 9 years old, that have a persistent vomit and abdominal pain. she go to the primary care unit. They don't think about dengue. They send with symptomatic treatment to your home. They continue to have a fever, abdominal pain, and in the day 5, he become worse. He become lethargic and go to the hospital again. And during this time, have the suspicion of, about dengue. They develop hypotension. They go to ICU care. In this time, they begin fluid reposition, but sadly, she died by dengue in your state. And the lesson that you had, it's they go to the primary care unit. I think for go to the primary unit in the first, I think the second day, they return to the home. They don't, these patients not follow up during the consecutive days, especially to check how the symptoms progress. Uh, you need to take care if you attend one children or adults and the symptoms don't improve. You need to think um, in the treatment, especially hydration, vigorous hydration, because the children didn't have a heart problems. You can do a good hydration and prevent develop severe case. I think the majority of the cases in Brazil that go to the ICU and unfortunately die is because they didn't have a good uh, uh, evaluation and good treatment in the first days.
Okay, so I think Eduardo just said that the one key message would be early diagnostics. And then, Julio, I understand that accurate diagnosis and adequate follow-up also is
Yeah.
key for preventing
Yes,
complications.
and sometimes in Brazil, it's have overlapping of other disease. In the past, with COVID-19, have some overlapping, and also now in 2024, and now you have a big auto push epidemic that have also symptoms of fever, rash, and is very complicated to clinical differentiation. Sometimes the best approach is to treat the arbovirus infection as a dengue, and especially respect about the hydration, especially respect about the children. And I think this is maybe the key message, especially in the country like Brazil that have several other arbovirus that occur in the same time. Let's see, in Brazil, you have during the same time, during the same seasonality, dengue, chikungunya, and oropouche. And it's very difficult to clinical differentiation among these three distinct arbovirus.
And as well, influenza, when not influenza, right?
Exactly.
And Eduardo, what's your experience in Southern Crohn?
During the COVID pandemic, we have COVID plus dengue at the same time. We say that a neologism, which is COVID dengue, because they have the same. In this outbreak, in the last outbreak, we don't see many co-infections. The main problem, I agree with Julio, is to confuse the diagnosis, saying that other diagnosis. In our setting, one of the diagnoses that has confused is leptospirosis is one, the other is chikungunya, in some kids, Kawasaki syndrome, okay? The other one are more or less the same, but flu is another that you have to add. And the main misdiagnosis is at the beginning, your son or your daughter has flu. Go to home, and this is easy to manage. And suddenly, after 2 days, are admitted in the hospital, no? Because 1/3 in our setting, 1/3 of patients who had warning signs were admitted in the hospital. This is it's a good number if you compare in the whole scenario, no?
Excellent. And I think I would add another syndrome that would be toxic shock syndrome, which could also present with
Yes.
fever, rash, and a very severe clinical presentation.
Good
That's
point.
also an option. So, Dr. Julio, can you share with us, just moving away from the clinical, the last one last question regarding clinical dengue. Can you share with us your experience on how can we prevent or early diagnose the complicated or severe cases of dengue with lab information?
I, I think you can keep your eyes in the hematoxin, but the majority of the time in Brazil, the children was admitted because the decrease of platelets, and sometimes the doctor like over diagnose dengue by the platelets, and sometimes is only the unique indication for hospitalization. You need to take care with this because during the big outbreaks, if you admit all the children because have a low platelets, low like close to 50,000, didn't have any wine sign, it's not correct because you put a lot of people in the hospitalization and forgot the children that have wine signals and it didn't have a place and beds for these children. It's good to take care during the big outbreaks, especially in respect about the admission, and the criteria is only the plates. And you see a lot of this in Brazil. You need to account for all the symptoms, and the plate is one component, but you have you have a severe blade in relate to the low platelets only if you have low than 20, low than 5,000. If the children is well, didn't have any wine signals, but have plates between uh, 50,000 and 100, it's good to keep this in the oral hydration, but it's not necessary to admit in the hospital. And I think the physician forgot to look at the symptoms and valorizate a lot the lab, especially the plated, to admit the children in the hospital. We need to take care of this in the big outbreaks because you need to select the children that have a high probability for develop severe dengue and needed to IV hydration.
The other thing that you have to see as a clinician is the liver enlargement, because liver enlargement is more than 2 centimeters, is another warning sign that sometimes is overlapping, because many pediatricians think the lab is mandatory. We find more or less the same that Julio. The increase of the hematocrit is another warning sign you have to keep about, no? And it's a cheap method to detect.
Thank you. If I may add just a very brief personal experience regarding platelets, we've seen a newborn which was hospitalized due to fever of unknown origin. And in the end, someone luckily I asked for a dengue test and it came positive, NS1, and it was dengue. And it's really interesting to see how it behaved just as the same way as adults or older children. So the platelets went down, 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 and then what happened? The pediatrician in charge gave platelets to the baby.
Oh my,
So oh my God! Yeah, exactly, exactly. So
yes.
because it was a newborn, and
Yeah.
I don't know what to do, and so it's very interesting to understand that platelets they have a very fixed behavior of going down, 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 then it comes up again in any age, and there is no need. If correct me if I'm wrong, Julio, but
You're right.
there is no need to provide platelets to the
Yes,
patients.
you see a lot of wrong indication for platelet transfusion based only in the value and don't
Yeah.
evaluate the patients, the context, the symptoms, the signs, the old medicine. You need to look the patients and
Yeah.
identify signs and symptoms, do a good physical exams to identify like fusion extravasation, that is another wine signal, and the doctors focus only in the lab and sometimes make a wrong decision based on this.
Wonderful. Thank you both. That section was very interesting. So now we're going to switch gears to vaccine implementation, both in Brazil and Argentina. So I'm going to ask you both, since both countries have been in the forefront of dengue vaccine implementation, if you can share some insights about how the vaccine was introduced in each one of your countries. We can start with Julio and then Eduardo. Thank you.
Uh, Brazil, it's the first country that approve and introduce in the public sector. And now you vaccinate more than 3 million children. You have a specific indication for 10 to 14 years old. Didn't have enough doses to provide to entire country, to all the cities in Brazil. We select the city that have high burden of the disease, especially for this age. It's a 2-dose vaccine, 9 days apart of 2 doses. You have low cover, especially for the second dose. 30% of the children return to receive the second dose. I think the most problem with the dengue vaccine is to choose this specific age, 10 between 14. In the South Asia, this is the high risk group for severity dengue. But in your region, Latin America, the elderly have more risk for the hospitalization and deaths. But the cool recommendation, WHO recommendation, it's between 6 and 16 years old, and Brazil follow this recommendation. It's okay. And when you have I lead a specific program in the city of Dourados that vaccinated the entire population. More than 90,000 people received the first dose, 40,000 people received the second dose. Uh, what you see during this mass vaccination, you have 2 cases of anaphylaxis. There's also, I think, Argentina reported, and but the majority of the time you have a mild side events, and you follow this massive vaccination to evaluate the impact and the effectiveness of the vaccine in your in Dorado City. I think Brazil probably generated a lot of data in this year, in the next year, in respect about safety and effectiveness, because you have this last program, and it'll be good to check, especially because you didn't have a good data in respect about the serotype 3 and 4 and the seronegative uh, individuals. It's good to check this. Now Brazil have a big outbreak of serotype 3 in São Paulo. Half of the cases of dengue in Brazil is related to serotype. It's in São Paulo, and 40% is related to serotype 3. And I think you have opportunity to evaluate this. I think it's my experience in the during the mass campaign vaccination, and also during the vaccination in Brazil, is a positive, but you have some challenge, especially with the age and the return of the children to receive the second dose.
Great. Eduardo, how about you?
Yeah, Argentina has approved the dengue vaccine in 2024. The approval was quite different for other countries because the approval was in age was from 4 years old and beyond. That means that if you want, you have, 90 years old, if you want to give the vaccine, you can receive it.
Mhm.
This is uh, an important difference because this is why Julio and Daniel, why in Argentina, um, older people have received the vaccine in the private sector because the vaccine for approval for the public sector, but as well for the private sector. That means that in the public sector, the vaccine was provided free, but in the private sector, people have to pay the
Mm,
vaccine. The other thing is that the decision of Argentina is to give the vaccine for the public sector in area when the disease is endemic with high density population and accumulative patient with dengue. Then in the big cities was not developed as well the vaccination. However, some provinces decide to buy directly to Takeda the vaccine, what is a little different, diríamos. The other thing is how do you decide who people should be vaccinated? We address the same age group, which is adolescent in Argentina, as well what World Health Organization recommends, and I see that Brazil is the same. However, in some provinces, which is interesting, decide to vaccine a key people, healthcare provider, policemen, firemen, in order to be sure that the key people for the community are well protected. The other thing, other province, and then you can see what's a little confused, decide to vaccine people who had dengue in the past, clinical and or confirmed dengue. This is what the first group to vaccine. However, in the deep south, Argentina, Patagonia, I see Daniel or Julio should be now over there. Patagonia, the government decide not to have any plan of vaccine. I agree, because the number of cases of dengue were extremely low in the deep south of Argentina. The other thing is interesting is that we have 50% of adolescents who receive the vaccine had not decided not to receive the second dose. 50% of the population who receive one dose has not the second dose. Then 50% of our population has incomplete vaccination. And this is important because one of the things that this vaccine has, or the original thing, is that we decide to give adolescent, which is an age group which is difficult to vaccine for any, to get the vaccine for any vaccine. Then we do not work to prepare this age group in order to receive the vaccine easily. And this is something that happened I think in Brazil should be the same. And then this is something that we have to manage differently. My opinion is that if you continue to vaccine adolescents, I think that the school could be a good place to run the vaccine, because all over there you can talk with the parents, send some information to the parents, that in order that the adolescents should be more comfortable to receive the vaccine. This is something that I think that is something that it should be to explore, no?
Great. Now, do you, any of you, this section, I think both of you are going to have to answer because you are the leaders in vaccines in Latin America. Do you think that people, as you said, Eduardo, I mean, in your country, in Argentina, you decided to vaccinate adolescents, so they're very hard to vaccinate. But do you think that it is only because people only didn't receive the second dose because they were young, they were adolescents, or according to what you have seen in the field, is there hesitancy as well for the vaccine? I mean, people don't trust these vaccines.
Yes, I can begin because I have a good experience to share, especially because I lead this mass vaccination program in Dourados. And what I learned with this, the majority of the people don't think the dengue it's a severity disease. They said, like Eduardo said, that's a middle disease. Why I need to be vaccinated? And the majority of the time, the access to the basic units to receive the vaccine, you have difficult to get access to be vaccinated there. Take 1 2 hours, needed to go in the work time. And I totally agree with Eduardo. You needed to choose all the strategy, especially for this age between 10 to 14. You need to vaccinate in the school. And when I did this in Dourados, I moved for like go to clinic, to the schools, universities, supermarkets, pharmacies, gene, in the companies. When you provide the vaccine in the place that the people can go and get the shot in less than 5 minutes, the people go. You didn't see a lot of hesitance in respect of dengue vaccine, You see, what you learn here is the opportunity. The people don't want to go to basic unit to receive a vaccine for a mild disease that is not severe disease. In the mind of the population, this is the sensation about the dengue. The wine is about the dengue, it's very low. And what complicated this, it's the access, it's not very good, especially for the adolescent. The adolescent is not a public that go very frequently in the basic unit. And that's the reason you need more innovation, especially to deliver this vaccine for the key population.
Do you think that I agree with you that people don't go because they don't have time, etc. But last year, 2024, we had a very, very severe dengue season with more than 7,000 cases deaths in Brazil, the highest case fatality rates in the planet, etc. Do you think it will change the mind of the people where you live? Do you believe that they see dengue differently after 2024, and maybe it will impact positively the vaccination rates?
I'm not optimist. I think that people continue to not think about dengue as severe disease. And I like dengue in Brazil kill more than COVID-19 and TB last year. It's the first leader of infectious disease killer in Brazil. General is TB, and in the past, during the pandemic, is COVID-19, but in 2024, not. This, all the time you go to the media, and you discuss among the specialists about this, but for general population, don't feel like this because they have an individual experience that have dengue and recover. The burden of the severe case and deaths it's high, but in general, the people believe that's a middle disease, and that's the reason you need to use other strategy to reach these adolescents.
Thank you, Julio. Back to you, Eduardo.
Now, one thing that I think is needed is a clear information to the target population about the vaccine, about the efficacy of the vaccine, adverse events, and the need to have to dose. I think that the government did not, at least in Argentina, did not explain clearly for the community that the vaccine has adequate efficacy, mainly for hospitalization, and the side effects are very low, very, very low. We have the numbers, 5 cases for severe adverse event, 5 cases for 100,000 vaccine given, which is very, very low. The other thing, with respectful, is that the misconception starts when the physician doesn't know about the vaccine. Then that means if you don't know exactly about the vaccine and you are confident about the vaccine, the message to the parents will not so good. Then I think that besides to give adequate information, medical education program for pediatricians in our case is mandatory. Otherwise, we have the problem because what's happened? I always say that uh, when the parents have doubts and sit down with the with the pediatrician, diríamos, es important that the pediatrician explain exactly what is the vaccine and how it does that. If you don't explain well or you have doubt as a physician, the hesitancy appears. So, well, the pediatrician is not convinced, then I will to wait. I think that education and role of the scientific society in this vaccine, which is not easy, is very important. The information and the formation of the human resource in public health. I think that this is something that we have to add, no? Because usually the question of the parent is it needed the vaccine? But at the second, at the same time, the vaccine is effective and the vaccine is safe. Usually when you say the vaccine is, you can explain, you get a better, more response for the parents. This is something that in this vaccine, which is not an easy vaccine because there was a lot of distractor and confounders about the vaccine, I think is mandatory. I think that Brazil will have a lot of experience. More than that, Brazil has a very promising vaccine in dengue for the Butantan Institute, and I think that is another option in the future for parents and for individuals. No.
And thank you, Eduardo. Last in this section, did you see a decrease in the number of, at least severe cases following vaccination? Have you seen that vaccine actually doing its magic?
No, it's only to comment. You receive a very low number of doses. It's impossible to have any impact about dengue vaccine with this low cover. And you hopefully, like Eduardo comment, with the Butantan vaccine and increase the Takeda production, you have more access to the number of the doses. The Brazilian government already said that by all the doses that it's available in the market, and because you have a several dengue outbreak in 2024, it's the part of the strategy. But you need a combined prevent strategy when you talk about dengue, because especially in Brazil, it's not only dengue, you have chikungunya, Zika, and oropouche. You need to continue to do vector control strategy. And Brazil also lead one good strategy by the Ministry of Health now support Volbac implementation in several cities. And I think this also is a good innovation with combination with the mass vaccination. You can decrease the burden of the disease. But when you look at the past, with the climate change and the increase in the temperature during the years, you have big outbreaks, and these outbreaks occur during the time and you have more impact in your country, and also in different regions that are not very common. Eduardo commented that Argentina become a country that now have outbreaks every year. In Brazil, you have the South region that's close to Argentina. In the past, you didn't have dengue, you didn't have chikungunya. Now become very common, and you know that this increase of the burden of the disease in our country and the region that now was affected is related to climate change. They increase the temperature, the have rain seasonality. This change a lot, and Brazil in the tropical area that's a lot has a lot of influence of this climate change.
Adding some comment from Argentina. In Argentina, the impact of the vaccine about the incidence of the disease severity is not clearly observed for different reasons. One is that the strategy was different in the province, as I mentioned it before. The second is the coverage, the vaccine was low. The third is the second dose was not receiving half of the individual. And the fourth is that we need time to see how you need time to increase the coverage in order to see what is the impact of the vaccine. For instance, in the private sector, many people decide to vaccine, especially old people, because in Argentina, the lethality is mainly in people that more than 60 years old, okay? Then this is our key population, unfortunately for this. In young kids and in adolescents or young adults, the disease was with high morbidity, but not with death. This is why, even though the Japanese vaccine has not any data above 60 years old, but we make a surveillance about what is the adverse events in older people, and we don't find almost anything. This was interesting because people with 80 years old, 90 years old, we have one people right there, we make surveillance 30,000 phone calls, okay, asking about that. And really it was important that all the people has not severe adverse events. We have, as Julio said, one cases of anaphylaxia in people who receive the vaccine. But real, the, 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 the severe adverse event in the vaccine is very low. And this is something you have to explain. For me, information and teaching is one of the key issues in this vaccine.
Absolutely. Thank you, Eduardo. Daniel, back to you.
Well, we are going towards the end of our conversation, and before that, Alicia, I think we could summarize what we've seen. I mean, we've spoke about severe dengue in both countries: Brazil, which has a lot of experience; Argentina, which is learning a lot from the last years, and both countries have introduced a vaccine against dengue in different uh, for different age groups and age limits, etc. So very interesting from experience that they add each other, learn topics to learn from what we've seen the last year. And my question to both of you, with that in mind, is what you expect for the future of the dengue prevention in each of your countries, not just in terms of prevention of vaccines, but considering we spoke a lot about education of pediatricians or clinicians, but how would you summarize what would you like to do for your country for the future, so numbers do not reach higher and higher numbers as we expect to see in Brazil, right, Julio? Unfortunately, uh, uh, I don't know, I can't foresee the future, but we expect that the number of cases increase every season in Brazil.
Let me say something which is interesting. I think that when the dengue is in the big cities, the dengue will stay there for a long time. This is one thing. Because the vector control is much difficult in the big city than close to the forest and so on. This is something we have to explain. Except if you use the Wolbachia method, okay, which I know the issue. No, I think that Brazil has some experience with the Bulbacia method. I think that this is promising, even though the cost to prepare the factory are expensive. This is my knowledge at least. The other thing, I think that in this setting, when this situation, I think that vaccine has a main role, not the most important role, because the most important role is eliminate the vector. If you eliminate the vector, you eliminate dengue. But eliminate the vector is not so easy. Going to the real life, let me see something which is important, which is the role of the pediatrician and the pediatric infectious disease people. For me, the pediatrician are the key people to talk with parents about the prevention of the disease, to explain exactly the disease. For us, really, in fact, the main for a pediatric infectious disease is provide information, teaching, advisory for the community and for the government. Many times in our government, they take the decision without analysis of the people who know the disease, who know the know-how about it. Then I think that pediatrician and pediatric infection specialist should going together, next together to prepare a bridge for this disease. But really, Daniel, I think this disease will stay for many years in Latin America. A good example is Argentina. For many years, we say, well, dengue is a problem in the north of the country, close to Brazil, close to Paraguay. Suddenly, become down, and arrive to big city, big city. Then the number of cases explain perfectly well that dengue, the mosquito, and the virus are prepared to continue uh, working over there.
Thank you for your insights, Eduardo. Thank you a lot. Julio?
Yes, I think you see some revolution, especially in the dengue prevention, because you did have good tools for dengue prevention in the past, and now you have some tools to deal with this. I think have more attention on this also. How you have dengue the south of United States, also in some
Europe,
countries,
Europe.
Europe, like in Italy, French,
Yeah,
local outbreaks, and the dengue become more important in the global health, especially when you're thinking climate change. The majority of the people said dengue will be the threat related to climate change, and you need to deal with this and increase the funding, especially to develop a new intervention. And for the next years, probably you have two vaccines for dengue, one from Takeda, one from Butantan. They try to expand your production. Probably you have more access to the vaccine. You can vaccinate the other ages. That's very important. Both companies have studied in the elderly. This will be very good, especially for Latin America. You want to vaccinate the elderly, but you need to check the efficacy, especially in this population, and safety. And also have other vector control strategy. A lot of people try to develop a new strategy, because when you look in the past and how the vector control strategy is not very effective. When you look at the data, you have few data from Mexico and Brazil that show between 30 and 50% of effectiveness in respect about community mobilization for vector control, and you needed to do better on this. But I agree with Daniel. It's a big challenge in the future, not only relate to the dengue, but all arboviruses that now you had. Chikungunya expand in Brazil. Dengue, almost all city have dengue case in Brazil. Didn't have any region that not affected by dengue. You have a expansion of chikungunya in other cities and places, and now auto pushing is restricted to the north, now become very common in the northwest, in the southwest, and I think this becomes very common in the future, and you need better prevention for, especially for arbovirus.
yeah. Let me say another little a brief comment. If the dengue will be very democratic and cases in worldwide will occur, vaccine will be the main tool because otherwise it's very difficult to make. I think it's very difficult to make the control of the vector. This is one thing. Singapore has a very good experience with Wolbachia, but probably it's a small country with many well-educated, and probably it's much easier. I think that Niterói has an experience in Brazil, um, but anyway,
Yes, my feelings, Eduardo, is need a combined strategy. Is
okay,
only one strategy, it's
no,
impossible to control dengue. You need a different
absolutely,
strategy, not only related to the prevention, but also related to the treatment. In Brazil, have 6,000 deaths, and the majority of these deaths is related with the patients not well be diagnosed, not
yeah, yeah, yeah,
well be treated specifically with hydration. You need, like you said, I think you need a lot of education. These new technologies need to put together, but it's a big challenge. I totally agree.
yeah.
Well, wonderful. It's been a wonderful episode. And I just want to thank you both for joining us and participating with us in this podcast. If any of you have any final thoughts or comments, you're welcome to give us those comments right now, and then we'll say goodbye. Thank you.
My only word is to thank to WSPID, and I enjoyed the podcast, especially with Daniel, Julio, and you, Alicia. Then I think that was really useful, and we interchange good thoughts.
Thank you. Thank you, Eduardo.
And that's the end of today's episode. Thank you again to our esteemed guests for sharing their expertise on this topic. To find further resources and educational content, you can visit the Global e-learning portal on the WSPID website, your hub for pediatric infectious disease insight.
Whether you are on your way to or from work or out for some daily exercise, thank you for listening to the WSPID podcast. Make sure you are subscribed to your favorite podcast platform so you don't miss an episode. Please share the podcast with your colleagues, leave us a review, and be sure to tune in next time.